CVS Health CEO Larry Merlo joins us now by phone for a CNBC exclusive interview. Thank you, Larry, for phoning in. First, on the test centers, are they up and running? Where are they, and who can get access?
Yeah, Sarah, we opened our first test center last Thursday in Shrewsbury, Mass., and we've gotten a tremendous number of learnings as a result of that. It is prioritizing our healthcare workers and first responders. We can do about 100 to 110 tests a day, and the tests are actually booked almost through the end of this week. And one of the things that we've learned, Sarah, is you think about the size of a CVS parking lot. We can get one drive-through lane operational. And, the learning is if we can take that concept to the parking lot of a closed school, then we could probably get 2, 3, 4 drive-through lanes and get as many as 400 to 500 tests done a day. So those are the discussions that we're having with state and local officials about where we go from where we are today.
So how quickly can you get this really going at scale across the country? You know, Larry, how important it is to test people to see who's at risk and who has immunity.
Yeah, and Sarah, look, this is a great example of public-private partnerships, and there are others that have joined us in this effort. Target, Walmart, Walgreens, Rite Aid, and we're working together as an industry to make testing more readily available. And, again, that work is being done at a local level. And, one of the rate-limiting steps is the availability of protective gear for those that are manning those sites, and that's something that we're working through.
What about workers, Larry? Have you got enough, and are you finding enough available?
Well, Wolf, I could not be more proud of the work that our CVS Health employees are doing, how they're responding to this health crisis, from our front store employees to healthcare professionals. There's a strong purpose in our colleagues wanting to play a role in helping their communities manage through this. And, they are doing yeoman's job, across the country. And, our announcement earlier this week of, 50,000 hires, some of that is reflecting some, open requisitions that we have. But, some of it is also responding to, the needs of our stores in terms of, supporting, our front lines in terms of the terrific work that they're doing.
What are you seeing in the stores, Larry?
I also saw the announcement you made that you're giving bonuses to frontline employees, and it's wonderful to see that you're doing that. Is that directly to compensate the frontline employees for the risks that they're taking?
Well, Wolf, there's a number of things that we began to do, a few weeks back when, the virus, came upon us. That, the first thing in following the CDC guidelines was, to ensure that we were following the quarantine properly for 14 days and ensuring that people who were quarantined continued to get paid. And, and what we heard from our colleagues, especially for those that needed to work on site, we have, about 80,000 of our colleagues who are working remotely at this point in time, and, that is going extremely well. And, but for those who need to be in the stores or perhaps, in some of our regional facilities supporting our stores, one of the things that we heard is as daycare centers close, how can you help? How can you support me with that? We've rolled out a program to provide daycare support. One of the things that we're emphasizing to all of our employees, if you don't feel well for any reason, stay at home. And we wanted to take off the table, the question of, well, I feel okay, and, I got a little sniffle, stay home, and not, have to deal with this issue of, well, my paycheck versus, staying home. So we introduced for our part-time employees a more flexible sick pay program that allows them to make that decision. And then, to your point earlier this week, we announced a bonus program, and it's really to reflect the extraordinary efforts that they're doing taking care of customers all across the country.
Larry, how much of your pharmacy business has moved online, and how should investors think about the margin difference there?
You know what, Sarah, it's a great question. And, some of the things that we've done for our customers is, we've waived delivery charges for home delivery of prescriptions and, other health-related items. We have seen nearly a 300% increase in, home delivery being utilized. And, it gives consumers the peace of mind of not having to leave the security and comfort of their home to get their needed prescription refills. And Sarah, you think about the fact today that we got 2/3 of the country that has one or more chronic diseases, hypertension, cardiovascular, diabetes, and more times than not, the management and treatment of those conditions is accompanied by prescription therapy. We need to make sure that those individuals are staying adherent to their prescription medications, and this is a key way, in which that's being done. We've also done things in terms of increasing access to care by, waiving telemedicine fees, encouraging folks to, utilize that service, and we talked about, COVID-19 testing, and in our insurance business, we are working with providers and hospitals to, expedite transitions in care that are, freeing up those important hospital beds in the highly impacted areas.
Yeah, I wanted to ask about Aetna, Larry, and how you're managing Aetna for what everyone is expecting to be a surge in unemployment, and how that's going to affect your business.
Well, Sarah, look, I think we're all anxiously awaiting the decisions coming out of Washington, D.C., and I know the stability of the insurance market and the ability for employees to be able to maintain their health insurance is critically important. And we hope to see payroll credit for premium subsidies, especially for small businesses, and COBRA subsidies for those that may lose their job, and the importance of them continuing to have access to health insurance. So we'll see what comes out of D.C.
And finally, you have such a good viewpoint, Larry, of the whole healthcare system. What do you make of the U.S. response so far, and where should we be focusing on?
Well, Sarah, as I mentioned earlier, tackling this crisis, it's not about politics and it's not about competition. It's about people working together, whether it's, the public-private partnerships that have emerged that are making a difference, or, Sarah, I've been on several conference calls over the last 2 weeks with competitors. And, in these conference calls, we're not competitors. We're an industry working hard to do the right thing for Americans all across the country. We're sharing what we're learning. We're sharing best practices. And as a result, we're doing great things together.